Phil Cohen. I'm a nuclear medicine specialist here at Initio, but I've been in practice at Lionsgate Hospital for the last 40 years. My background is internal medicine and radiology. I went into nuclear medicine. 1 in 6 men ultimately are going to get prostate cancer.
I'm Terry Chaters. I'm 65 years old. I worked most of my career in the truck repair industry for truck leasing companies. So I try to retire a little bit early so we can get out and enjoy life. You just don't know what's around the corner.
So yeah, as I said, I have 6 brothers. 2 had prostate cancers. But for me, somehow the doctor said that it's gone out in prostate. So it's very, very advanced.
Well, I'm Dr. François Lamoureux. I was trained in Sherbrooke in Quebec, and I'm a specialist in nuclear medicine. And I'm also at the moment the president of the Canadian Association of Nuclear Medicine in Canada. When you have a cancer, you don't have only one cell, you have millions of cells. So it's not a local disease, it's a systemic disease. And this is what this new tracer, like ILLUCCIX, is giving us the key to do a whole body investigation.
I first became aware of prostate cancer in 2004 and immediately had radical prostatectomy, and it didn't stop it.
My Gleason number was a 7, so kind of a low to medium right there on the bubble, but it looked like some of the cells were aggressive. So that's when I learned I had cancer. So it's been a long haul from July 7th, get all the way back to May here, and I still haven't been treated. So that's my big concern.
I think most of the patients that we saw had already had standard treatments. So the standard treatment for prostate cancer is to remove the prostate if it hasn't spread. That the surgery is really almost unnecessary if it has spread. None of these tests, the standard tests, are specific for cancer.
Suggested, well, if you really want to find out, like I had 3 scans, an MRI and 2 CT scans, and they just weren't, I guess, focused enough.
I tried the chemo and it didn't work, so PSA is going up. And then that's when they told me about EP. And that's what I thought.
And nothing definitive. They kept coming back, and the call was like, it's all good, it's all good, it's all clear, can't see anything. Why is the PSA? But then it's like back to the only indicator they have, right? Why is the PSA going up? If you can't see anything with what we got going on, you got to kick it up a notch. And that's where Initio came in.
So ILLUCCIX is one of the newer diagnostic agents that have come out. Basically, what we do is attach a radioactive material, in this case it's gallium-68, to a targeting agent, which is ILLUCCIX, that will target the prostate-specific membrane antigen that's overexpressed on prostate cancer.
Today, we can have them in 3 dimensions or in color. So we can have a map in red for all where the lesions are. So it's very easy to see. It's a very target-specific to the cancerous cell.
One of my colleagues described it's like shining a light from inside out.
My doctor made a suggestion that this was available. At first he said that there were trials for this, but then he told me I was unlikely to meet any of those requirements. Then he said that there was an opportunity to pay for it. And then I just asked him, I said, well, what would you do? And he says, I would do it.
The next step, in my opinion, is our targeted radionuclide therapy, which uses compounds that will actually give quite lethal amounts of radiation, not to the patient, but to the cancer.
Problem, it's sort of like you want your treatment to be as less invasive, optimal, and try to stay away from the negative parts of it.
So the radiation, the dose is very, very small. There is practically no side effect. It's not painful, it's not dangerous, it's not invasive.
But if indeed it has gone elsewhere, then we need to know. We need to know so that that can be dealt with as quickly as possible, because as we know, cancer doesn't wait.
Imagine, I'm very excited. I want to get on with my treatment. And from what I know about this treatment, it's going to identify exactly where the cancer is. And it's going to give my oncologist a chance to treat me properly. And that has to be number one. But I need to be around for my wife and I need to be around for my grandkids. That's so important.
Like, we couldn't really break down. We had to be strong also because, you know, my girls were there to help support us and to talk about things that you don't really want to, you kind of avoid.
With the generator, you basically have the generator and a kit, such as ILLUCCIX. You just elute the radioactivity, inject it into the kit, shake it up, and you're ready to inject it into the patient. You know, we're producing it locally, right here at Initio. The generator is here and the kits are here, so you don't need a dedicated radiochemist to produce it, and how we go about treating. And that's going to change radically as we have evidence that the treatment with PSMA is more effective earlier on.
Canada has been a leader in the production of radionuclides, and the quality of nuclear medicine here in Canada is well recognized all over the world. Even if myself, at my age, I will have some prostate cancer cell, I will go for those tests with ILLUCCIX, and because I know now we have a treatment, we have something to offer to the patient.
Thank you for the encouragement.
Why don't we see each other again in 20 years?
Okay.
Not only give hope to the patient, but even if you have a cancer, you can live 20, 30 more years.
There's no question it's a game changer. I think every man should probably have one of these for diagnosis. That's not generally accepted yet, but I'm fairly confident it will be.
For the best care, you really got to chase it yourself. You want something, you've got to go after it.
And I'm sure that this will help hundreds or thousands of people going forward. It has to. And at the end of the day, it's going to be more economical for our healthcare systems because they're going to give the doctors the information they need to make good decisions, proper decisions, not over-treat you, treat you enough to clear up the cancer and move on. What tools do we have in a box that we can help speed up the process?
It's going to be a lot easier and I believe also significantly cheaper over the next year or so as we do more of these scans. The public will see that the costs are going to drop quite substantially.
In the broad realm of things, well, I'm certain it's a step forward for, well, perhaps so many more too. I mean, this is not going away.
We're talking about prostate cancer, but within maybe 1 year or 2 years, it will be the same for breast cancer, for colonic cancer, and all kidney cancer. So it's just the beginning. It's more than a breakthrough. It's a revolution.
I think your founder here has stepped up and he's made a decision. I want to help people. He made that clear to me on a phone call I had with him on Friday.
As I said, you guys are lifesavers to me. I can go home now and basically say, okay, I'm not terminally ill. Just go after the cancer.
I think the work that this clinic does will be, or is going to do, will be just on the cutting edge of diagnostics here. I mean, we need this desperately.